or last Tuesday of the month from July 2021 to June 2022, and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MU Webinars, and YouTube at tinyurl.com/MUWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the affirmation platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Sorority and the UP College of Medicine. The beneficiary of this event is the UP PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022, and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MUWebinars, and YouTube at tinyurl.com/MUWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Sorority and the UP College of Medicine. The beneficiary of this event is the UP PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022. and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at New Webinars, and YouTube at tinyurl.com/newwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes. Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Sorority and the UP College of Medicine. The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at New Webinars, and YouTube at tinyurl.com/newwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Welcome to the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Sorority and the UP College of Medicine. The beneficiary of this event is the UP PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MU Webinars, and YouTube at tinyurl.com/MUWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes. Welcome to the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Sorority and the UP College of Medicine. The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the affirmation platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
God our Father, we come to you in our need to ask your protection against the COVID-19 virus that has claimed lives and has affected many. We pray for your grace for the people tasked with studying the nature and cause of this virus and its disease, and of stemming the tide of its transmission. Guide the hands and minds of medical experts that they may minister to the sick with competence and compassion, and of those governments and private agencies that must find cure and solution to this pandemic. We pray for those afflicted. May they be restored to health soon. Grant us the grace to work for the good of all and to help those in need. Grant this through our Lord Jesus Christ, your Son, who lives and reigns with you in the unity of the Holy Spirit, God, forever and ever. Amen. Mary, help of all Christians, pray for us. Saint Raphael the Archangel, pray for us. Saint Roch, pray for us. Saint Lorenzo Ruiz, pray for us. Saint Pedro Calungsod, pray for us.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Sorority and the UP College of Medicine. The beneficiary of this event is the UP PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM live stream. The title of today's forum is Taking Control of Your Health, Why Executive Checkup Matters. Ang inyong kalusugan ay nasa inyong kamay. Bakit mahalaga ang executive checkup? Today's forum aims to tackle the importance of the long-term benefits of executive checkups, the indications for each test, the pertinent findings including the appropriate management, and as well as the costs of having an executive checkup. The moderator for today's forum is Dr. Anna York Bondok, who is a pulmonary oncologist, surgical and medical intensive care physician, and a former congresswoman for Pampanga's 4th District.
Hello, everyone, and welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. And this event is brought to you by the Mu Sigma Phi Sorority and the UP College of Medicine. And this forum will consist of a series of panel discussions that aims to discuss common occurrences from all walks of life. And today we will have the first of our series, which will focus on the importance of the executive checkup. So later on, we invite you to put questions below for our speakers and for our reactors. You may type them into the Q&A chat boxes of the UP Manila live stream and Zoom, or the chat boxes of FB Live and YouTube. So please join us, and we will start in a few minutes. So today, we are humbled, since this is the start of our forum, we are humbled to have Dr. Lourdes Sheroes, who is the daughter of our well-loved and respected mentor, Doktora Julita Ramoso-Jalbuena. Like her mom, Dr. Sheroes is also an OB-GYN and with a specialty in maternal and fetal medicine. So to represent the family of Doktora Ramoso-Jalbuena, we have Dr. Lourdes Sheroes. Doktora, please join us.
Thank you. Thank you. Thank you, Dr. Bondok. That was very nice. Anyway, hello to those in the medical field and other participants. I am Lourdes Lulu Jalbuena Sheroes, and my only claim to fame is being the daughter of Doktora Julita Ramoso-Jalbuena. I extend my heartfelt gratitude to Mu Sigma Phi Sorority of UP College of Medicine for honoring my mom as the inspiration of a monthly webinar on health. It's so appropriate because my mom was both an educator and a lifelong learner. For her, education and knowledge are shared, and this sharing leads to service to the community. And this is probably one of the missions of this monthly forum. Mom had so many accomplishments, but two stand out for me. As a chief resident in PGH, she founded the first blood bank in the Department of OBGYN in response to deaths from maternal hemorrhage. And from there, the rest of the hospital followed suit. Later in life, she was the founding president of the Philippine Climacteric Society to empower women in those so-called waning years, now considered as the most productive period in life. I say that as one a senior citizen too. It's like as if mom grew older with her patients and she recognized their needs and sought to enhance their lives. At this time, rather than speak about mom, let me speak from her own words to you, as in a speech she gave to the graduating fellows and residents of the Department of OBGYN in 2007. She said, "You are fortunate to have graduated from a prestigious institution. Treat your training as a special gift meant to be used by you for the benefit of others, and then pass it on in turn. Your destiny lies in the place you are needed the most, not in the place where you need the most. Art, not strength. We know what this means in obstetrics, specifically forceps deliveries. But I submit to you that this works in life as well. Lies in the place. Do not think of your life as a profession, but as a mission. A profession is something you engaged in on a day-to-day basis, marked by diplomas, tasks, and speech. But a mission defines your life and infuses that life with joy. Touch your patients with your hands to let them know that you want to be near them. Maybe not so much now, right, with COVID. And with your heart to let them know that you care for them. What is important is that you are doing God's work on earth, caring for the works of His creation, your neighbors that He loves so much. And at the end of the day, when your last light has faded, you will stand before the Creator and smile as He says, "Welcome home." May God bless us all and our endeavors to enhance medical education and health services in the Philippines. Thank you very much. You are muted, Anna. Sorry, you are muted.
Thank you so much, Dr. Lulu, for your message.
Yes.
And I'd like to personally let you know that I met Doktora Jalbuena when I was still a student, and she was really so nice. So it's really a big honor for us to honor her today.
Okay. Likewise, thank you. And my family is very grateful.
Okay. Thanks, Dr. Lulu. Salamat po.
Yes.
And now we come to the point of the introduction po of Dr. Efren Domingo, who is the chairman of the UP PGH Department of Obstetrics and Gynecology. And this department is going to be our main beneficiary. So the Mula kay Doktora, Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum will be for the benefit of the Department of OB-GYN. And with us today, we listen to the inaugural message of the chair of the Department of OB-GYN, who is himself an accomplished academician, a researcher, and a clinician. And he is also happy and proud to be a former student of Doktora Julita Ramoso-Jalbuena. And that is none other than esteemed OB-GYN oncologist. And I'd like to add my personal note, he is also po the oncologist of my best friend. So talagang I have a personal connection with the chairman, Dr. Efren J. Domingo. Sir, your message po.
Good morning. I'm Dr. Efren J. Domingo, the chairman of the Department of Obstetrics and Gynecology, UP College of Medicine, Philippine General Hospital. welcome and I open the Women's Health Forum, Julita of the Mu Sigma Phi. I am so fortunate that our department is the beneficiary of this endeavor. Today, they are going to conduct a webinar for the benefit of the women of the Philippines. I am so happy to be the beneficiary in behalf of the 74 consultants of the department. By the way, the department is the house of 11 subspecialties, the only hospital in the Philippines with 11 organized subspecialties, divisions, units, and teams. The most recent addition was the Patient Education Unit, the Division of Sexual Health Services, the Family Planning Unit, the In Vitro Fertilization Center, and the Robot Gynecology Surgery Team. Indeed, as we face the future, the proceeds from your Julita-Jalbuena Women's Health Forum will benefit the department and the women of the country. Thank you very much for this opportunity, and I wish you all the success in your present and future projects. Magandang umaga po. Salamat.
Thank you so much, Dr. Domingo. Salamat po for that very inspiring message. And ang laki na rin po pala ng Department of OB-GYN in PGH, and we are happy that we are going to be helping the 11 parts of the department po to grow and to prosper. So let's move on to our webinar forum. And our first webinar forum is entitled, Taking Control of Your Health, Why Executive Checkup Matters. And ang inyong kalusugan ay nasa inyong kamay at bakit po mahalaga ang executive checkup. So we aim to tackle the long-term benefits of having checkups. And this forum will also enlighten us to the indications of the tests that are normally performed, as well as the pertinent findings and the necessary management. So to formally start our webinar forum, please let me introduce our esteemed, young but esteemed speakers. So for today, we are so honored to be with two beautiful sisters from the Mu Sigma Phi, who are classmates also in the UP College of Medicine. So today, we are honored to have Dr. Monica Therese Mitos, Kating Cabral, and Doktora Alexandra Dang Laya, who are both classmates from the UP College of Medicine class 2001, and I'm proud to say are fellow sisters of the Mu Sigma Phi Sorority. Both of our speakers are internists and subspecialists, with Dr. Mitos Cabral being an endocrinologist. Mitos is a graduate of UP class 2001. She did her fellowship also at the UP PGH in endocrinology, diabetes, and metabolism. And currently, Mitos works, kung gusto niyo pong magpakonsulta sa kanya, at the Asian Hospital Medical Center, the Makati Medical Center, and the St. Luke's Medical Center in Global City. Our second speaker is Doktora Alexandra Laya. She's also from the University of the Philippines, class of 2001. She did her fellowship abroad in gastroenterology at the University of Missouri, Kansas City Graduate School of Medicine. And currently, Dr. Laya works as a consultant at the St. Luke's Medical Center in Global City. So these are both intelligent women, and we're very, very happy to hear their thoughts po on executive checkup. So let's begin with our first speaker. Our first speaker is Doktora Alexandra Dang Laya. So Dr. Laya, we are honored to hear your talk.
Hello, good afternoon, everyone. I will start my share screen. Give me 1 second. Okay. Please let me know if you can clearly see the screen already. Is it working?
Working well.
Sorry, teka. Sorry, I cannot see my screen. And can you see it now? Okay. Thank you again for having us here today. It's super exciting to talk about ways on how we can take control of our health. And so we start with talking about executive checkups. When you go on the internet, on Google, if you Google checkups, this is what you are going to see. You are going to see things about executive checkups. Because of busy schedules, it's very appealing to do an executive checkup. These are packages that make for a one-stop shop, like a top-to-toe health check. Now, the thing is, the kind of tests included in these packages differ from one package to another, a different hospital to another, and also the cost of these checkups run from as low as a few thousand all the way to sky's the limit. And so if it's overwhelming for us as clinicians, imagine how it must be for our patients. So it's our role to help guide our patients choose, or better yet, help our patients design their own executive checkup package that will suit their needs. So how do we go about this? Today we hope to review various aspects of health checkups. We want to get to empower you to recognize risk factors for common illnesses so that we can help our patients personalize their health checks, screen for cancer, and initiate prevention programs. We also want to go beyond the executive checkup so that we can become partners for our patients' health. We'll also talk a little bit about warnings and caveats of testing and cancer screening. And I think that's the best place to start. Prevention and screening is one of the most difficult areas of medicine. There's no one single source for these recommendations. Multiple organizations and societies produce guidelines on the same topic. The recommendations are constantly changing with new innovation, research, information coming out. So we should remember that benefits of screening may be overestimated and the harms of screening may be ignored or minimized. Admittedly, industry and government funding can greatly influence screening and prevention practices. So before we go forward with talking about the executive checkup, maybe we have to start and keep in mind that the more apt terminology is actually more of a periodic health checkup and cancer screening, which brings us the two parts and two aspects of this, the periodic health checkup and cancer screening. And my beautiful colleague sister, our beautiful colleague sister, Dr. Cabral, will talk about the periodic health checkup, and I will focus more on the cancer screening aspect. Okay, cancer screening. Remember what we said about multiple societies recommending things on same topics? It can get confusing. So I did a bit of research on what societies recommend, what experts say, and also what we do in local practice. And we're going to talk about that. These are not lotto numbers. These are important age milestones when we talk about cancer screening. It's important to note that screening is for asymptomatic, average risk individuals. This is in contrast to patients who have symptoms where the approach is more case finding and diagnosis. So the first one we'll talk about is skin cancer. Mole checks or screening for melanoma is simply visual inspection. There is no specific recommended age to do this. We can encourage our patients to do their own skin checks. It's just important that we remind them or we get to look at the parts of a patient's body that they don't get to usually see. Focus on higher risk groups, those who have fair skin, those who have history of sunburns or use of tanning beds, occupational risk, those who are under the sun all the time, patients with personal or family history of skin cancer, and patients who just have a lot of moles. Papa Nicolau smears are important in the fight against cervical cancer, and this is the next cancer that we are going to talk about and how we can screen for it. It is recommended to initiate screening at age 21. Now, between age 21 to 30, Pap smear every 3 years have been recommended. between the age of 31 to 64, you continue pap smears every 3 years, or you can opt to perform co-testing with HPV detection every 5 years. For patients older than 65, routine screening can stop, particularly if screening has been normal in the previous years. Breast cancer screening. Okay, 40. 40 is an important number when we talk about breast cancer. Although big societies like the American Cancer Society and the USPSTF, they recommend mammograms to start at 45 or 50 years of age, most local and international societies that manage breast cancer follow the 40-year-old cutoff. What I tend to do is have a sit down with patients when they turn 40 and offer a baseline screen. After that, you can do a yearly mammogram starting age 45, downgrade or transition down to every 2-year mammograms at age 55, and you can continue on so long as patients remain in good health. Generally, it is recommended to stop screening at age 80 or when their life expectancy is less than 5 to 10 years. Colorectal cancer screening is close to my heart. I'm a gastroenterologist, so it's close to my heart. I have seen a rise in pre-malignant lesions among younger patients in the last years. And so the more recent updates from societies have been very much needed. 45 is the new 50. We always thought 50 is the colon cancer screening age, but it's now 45. There are various screening strategies for colon cancer: scope, scan, or stool. So there's 3. So you either do a scope, a colonoscopy every 10 years, or a flexible sigmoidoscopy every 5 years in conjunction with an annual stool exam called an FIT. You can also opt to do a scan, a CT colonoscopy every 5 years, or just do simple stool exams, an FIT annually. Now, there are pros and cons to each testing option. It would be really best individualized to each patient. And regardless, I often tell patients, pick one, anyone, because any one test is better than no test. Again, the recommendation is to start at 45 and continue on until patients are around 75 years of age. The surveillance protocols during this period really depends on an individual's screening history result, depending on their overall health, and depending on their own preference. I often tease patients that they graduate when they turn 76 above. So after 75, they graduate. Now, patients who are over 76, the decision to continue screening has to be individualized. With gains in life expectancy, we have an increasing population of healthy geriatric individuals. And so we need to think, how long are we going to continue doing this? We know that benefits of a polypectomy are delayed by 7 to 10 years. And so screening is very limited for those, the benefit of screening is limited for those who have a shortened life expectancy. So the cutoff is around 7 to 10 years. Lung cancer is on the top 3 of malignancies in the Philippines. And the screening test recommended for this is an annual low-dose chest CT. Now, the limiting factor for us with this screening test is still cost. So the general population, they cannot afford an annual low-dose chest CT. And so a surrogate has become the chest X-ray. But we still would want to try to encourage low-dose chest CT scan for those who are at high risk, who are former or current smokers who quit less than 15 years, those between 50 and 80 years of age, those who have a 20-pack year smoking history. You can opt to stop screening at age 81 if they've quit more than 15 years past, or if their overall health status is poor. Prostate cancer is not in the forefront of cancers, but it still ranks number 4. And so the screening tests for prostate cancer include a digital rectal exam or a PSA blood test. Routine screening for prostate cancer is recommended for healthy men between 55 and 69 years of age. Now, just as important it is in knowing who to screen, we should remember who we should not screen. It is not recommended to screen those who are younger than 40 or older than 70, or when their life expectancy is less than 10 to 15 years. It's pretty amazing how much innovations have developed in terms of testing and screening, but we always have to remember that we have to individualize. We have to talk to our patients so that we can have a shared decision when it comes to screening. On the upside, a normal screening test is reassuring and can lead to prevention of cancer and promote good health. Early detection can lead to cure, mitigate complications of cancer, and can even prolong life. On the downside, there are risks inherent to each screening test or procedure. We have to deal with cost and availability of resources. We have to talk about false positive and false negative results. And sometimes it triggers more tests or unnecessary procedures. And so just like we share decisions in medicine, I also want to share screen time with our dear colleague and sister, Dr. Monica Cabral. And so I will stop sharing my screen here. Thank you.
Thank you, Dan, for walking us through cancer screening. I know that's one of the scarier things that we like to talk about and screen for, definitely, because it really is easier to screen for something, prevent something, and treat something when it's caught earlier. Now, while there are certain ages for when cancer screening is recommended, there are no strict guidelines for the optimal frequency of periodic visits, however. I'm sorry, can you see my slides now?
Yeah.
Okay, thank you very much. All right. So annual examinations are not indicated for most younger patients, although people with chronic health issues such as diabetes do warrant regular visits with or without a periodic health maintenance visit, independent of your age. So most physicians and physicians like myself, as an endocrinologist, I see patients with diabetes at least every 3 months because this coincides with their HbA1c, one of the markers that we check in diabetes. In the absence of such indications, experts suggest that periodic health maintenance visits should be done every 3 years for adult patients less than 49 years old who don't have chronic conditions. And once you turn 50, you get an annual checkup. For people who have no chronic conditions and rarely see a clinician, however, a periodic health evaluation or a periodic checkup may be the only opportunity to discuss preventive care, thus the popularity of the annual wellness visit or the executive checkup. All adults should be assessed for risk factors for cardiovascular disease at every visit. And these modifiable risk factors include the diet, if they have a high blood pressure, if they're overweight or obese, if they have diabetes, if they currently smoke, if they have high cholesterol, and if they live sedentary lifestyles. When it comes to hypertension, screening is recommended for adults 18 and above. While the optimal interval, again, is not known, most patients do have their blood pressure checked at each visit anyway. Screening should be done every year for adults 40 years and above if you're at higher risk for high blood pressure, meaning you have already had measurements with a daytime blood pressure of about 130 to 139 over 80 to 89, and those who are overweight or obese. Adults under 40 who do not have an elevated blood pressure and who do not have any of those disease risk factors that I mentioned should be screened every 3 to 5 years. But again, everybody gets their blood pressure checked when they see a doctor. Now, when you do diagnose a patient with a high blood pressure, you get a high blood pressure reading in the office, it is recommended that you get an out-of-office blood pressure measurement to confirm the diagnosis before starting treatment, because some patients can just have elevated high blood pressures in the office or have what we call white coat hypertension. Surprisingly, a routine ECG, even for a baseline, is not indicated in asymptomatic adults, meaning adults who do not feel any chest pain or chest discomfort, and if they are at low risk for cardiovascular disease. So generally, healthy individuals do not need a routine baseline electrocardiogram or ECG. Unfortunately, a routine ECG has a low sensitivity for detecting the presence of coronary heart disease in patients who do not have a prior diagnosis. Another thing that may come as a surprise to most people is that even though most wellness packages do offer an exercise stress test, in general, it is not recommended for patients without symptoms. It may be appropriate, however, to screen patients who are in certain high-risk populations or occupations, for example, pilots or bus drivers, where if they had an acute cardiac event or if they had a heart attack during their job, this could endanger a large number of people. It is also recommended to do a stress test in individuals with a high risk for coronary heart disease who are beginning an exercise program. So you have a patient who may be living a sedentary lifestyle and decides to embark on a marathon run. Maybe these patients should have a stress test first. Now, this is something close to my heart as an endocrinologist. We should really consider screening for diabetes of high-risk individuals beginning at the age of 40 to 45. Now, in the Philippines, we have found that we have about a prevalence of 7.1% of adults who are now diagnosed with diabetes. And that number goes up actually to about 12% if you consider patients with pre-diabetes. So we've seen that at age 40, the prevalence does increase, and thus the recommendation to start it at 40 years old among Filipinos. Other guidelines around the world suggest at 45 years old. Now, they can be done annually or in general at 3-year intervals, depending again on the frequency as clinically indicated by what's going on with the patient. If the patient has already had borderline tests in the past, you know that they are overweight or obese, they have very strong family history, for example, then you should already test them even before the age of 40. Now, if patients do have glucose readings that are abnormal, they should receive intensive behavioral counseling interventions to promote a healthful diet and physical activity, because this alone may be enough to get their sugars under control. We can do testing with either fasting blood sugar, oral glucose tolerance test. The HbA1c is not the screening test of choice. It's because this is an average of blood sugars over the past 3 months, but it may mask, for example, elevated sugars that could be obtained from a glucose tolerance test instead. When it comes to cholesterol, really most adults should have it screened every 5 years, beginning at the age of 20, and younger if, more frequent testing if there is a higher risk for the development of atherosclerotic disease. When it comes to osteoporosis, screening with a bone mineral density test should be done for women who are 65 or older and men who are 70 or older. If women are postmenopausal but are less than the age of 65, you can check them with the bone density if they already have risk factors, and this goes as well for younger men. Anyone who has family history of osteoporosis and fragility fractures, if they're underweight, have a history of smoking and alcohol use, and also if they use medications which decrease bone density and chronic steroid use, should really be screened earlier. All adults who have had a fragility fracture, a low trauma fracture, should also be screened for osteoporosis. And this is important because patients do not have symptoms, for example, with osteoporosis. You do not know that you're losing bone. And sometimes the first symptom of it is a fracture and the pain that comes with it. So we want to avoid that very first fracture. Other aspects of a patient's health should also be addressed at these periodic checkups. This is probably the only time patients may be assessed for their weight and their body mass index, which is how heavy they are for their height. You can assess them for any time spent exercising, if any, if they smoke or are exposed to secondhand smoke, any possible substance abuse, increased alcohol intake, and their dental health as well. This is also an opportunity to advise women who are planning pregnancy or not on healthy behavior, intake of prenatal vitamins, and counseling of fathers-to-be as well. A periodic health check may also be the only time that we can help patients deal with any psychosocial issues, such as depression or anxiety. Adults should also be offered catch-up immunization or boosters as appropriate. Most often, adults ask about the annual flu vaccination, the pneumonia vaccine, and in this pandemic age, about COVID-19 vaccines. The MUla Phi Sorority also has its vaccination advocacy program as well, called Immunity. So screening for health conditions does matter, But remember that when we order a test, we should understand how to, one, interpret these results. Number two, the implications of negative or positive results. And three, if these results will make an impact on our patient's health. So many healthcare providers do understand the need for these screening tests, and they have really made it convenient for patients to get their tests done in 1 to 2 days, at one-stop shop. But really, patients and doctors should work together to decide on the most appropriate tests for them. And with that, thank you very much. We hope we have been able to run through the various screening tests available and some of the best times to do these tests. And remember to always ask your doctor if you are unsure of which tests to get.
Thank you so much, Dr. Mitos and Dr. Dang, for these very informative, short but informative talks. So let's move on to our next. This is a reactor. So we are joined by a very young physician who is a recent graduate of the West Visayas State University College of Medicine. And she will give us a reaction to the two talks. She's a West Visayas State University graduate. Kahapon lang po. She's a cum laude in BS Psychology of the University of the Philippines, Diliman. Pareho kami. And she's a contributing writer of the Daily Guardian. So let's welcome Doktora, new Doktora Niza Ann E. Regalado. Niza, Doktora Niza, please share us your thoughts. And nasan ka ngayon before you start?
So good morning, Doc Anna. Good morning, everyone. So I'm actually based po in Iloilo City. And as Doc Anna mentioned, I'm, along with being a fresh grad, kahapon lang kinonfirm sa exit interview. Nag-graduate po talaga ako. I'm also a contributing free writer to the Daily Guardian, which is a regional newspaper here in Western Visayas po. So I really just wanted to start off by thanking Dr. Laya and Dr. Cabral for sharing their experience and knowledge, which I'm sure they've gathered from years and years of continued learning. I'm honored to have been invited by the Mu Sigma Phi Sorority to share my thoughts as someone who is on the other side of the spectrum, someone who's really just starting their journey in the field of medicine. Of the many things that we learned today, I wanted to emphasize two key takeaways. First is that as physicians, we should be emphasizing the importance of the executive checkup. And second, as physicians, we should really strengthen the primary healthcare in our healthcare delivery system. So first off, throughout the talk, we've stressed the importance of executive checkup. At the very start of this webinar, Dr. Laya stated that prevention and screening is one of the most difficult areas of medicine. And however, throughout the talk, we saw that it's not just difficult, but more importantly, it is essential for our health. And I found this very interesting because Dr. Cabral mentioned the concept of anticipatory guidance, which is a concept that personally I'm more familiar with in pediatrics, because if you've noticed in the pediatric population, there's such an emphasis on well baby visits and checkups, and parents, if their children are having any difficulties, they immediately bring them to the doctor. But for some reason, as we get older, as we have more responsibilities, we're in the working population, we seem not to come in for checkups as much as adults. And I think that as physicians, this is something that this is a perspective that we should be changing. Now that we're adults, now that we do have more responsibilities, all the more executive checkup and periodic screening is all the more important. And I think that we can't mention this without also mentioning that the role of primary healthcare in ensuring that people see a physician and that people have periodic checkups. It was mentioned by Dr. Laya that there's no single source of recommendations and that multiple orgs and societies produce guidelines on the same topics, but then also the institutions that do provide executive checkup are hospitals, are tertiary institutions. And that's actually how I would like to end this reaction, specifically as someone who is just starting off their journey, as someone who is trained to be a GP and not yet into specializing and not yet associated with a tertiary hospital. My question for today is that if the goal of executive checkup is prevention and screening in order to not just prevent early mortality, but as well as to reduce morbidity, wouldn't we, as a healthcare system, be better able to meet this goal if we brought executive checkups down to the level of primary care or down to the level of the community? I think that that's something that I want us to think about in terms of our role as physicians, not just in taking care of the patients, but our role as physicians in ensuring systemic change that we may be able to reach as many patients as possible. Thank you.
Thank you so much for that reaction, Dr. Aniza. So ngayon po, we're opening our Q&A. I think the first question is by Dr. Aniza. Pero bago po yon, let's just invite everyone. Sa lahat po ng mga nanonood today, please type in your questions in the chat box. We have allotted a lot of time po sa the Q&A. So sa chat box, sa mga comments po on FB, please type in your questions and we will be glad to answer them. So I invite Dr. Dang and Dr. Mitos to join us po para masagot po natin yung tanong ni Dr. Nisa. And lilinawin ko lang po, no? I think your question, Dr. Nisa, is bakit, kumusta na yung public sector sa pagbigay ng executive check-up or preventive medicine? So, Dr. Mitos, Dr. Dang, would you like to, any one of you na gusto pong sumagot and maybe invite po our moderator to share our pictures po dito para apat po kami nag-uusap. And after you, meron akong i-share sa'yo, Dr. Anisa, para malaman mo yung public. Kasi yun ang specialty ko. Sige. Dr. Dang, Dr. Mitos would like to answer the question po ni Dr. Anisa.
Okay, I'm going to give a few examples more in the GI perspective. Parang let's try to decentralize, I suppose. But for example, when it comes to colon cancer screening, we have all these big programs for colon cancer screening, prevention, colonoscopy, those kinds of things, and they can get really expensive. Now, when it comes to, the general population, PhilHealth is the backbone of our healthcare coverage for the average Filipino. And PhilHealth has already also created these packages that will cover for colon cancer screening and treatment. Ito yung mga Z packages. And this is actually available. It's not actually, if I'm not mistaken, it's not available for the private sector. It really is for government hospitals. So it's designed to be able to reach the average Filipino. So we do have these things. It's just that we have to, look for it, and so that we can be able to offer it to our patients. So meron naman. I guess because of how the healthcare is set up here in our country, sometimes it's tough. People pay out of pocket, and so if you don't have insurance coverage, we are a bit compromised. Lugi tayo ng konti, and so we try to have to act. We have to really find a way to advocate for our patients. Thank you.
So it really is, yes, Dr.
Yeah,
I'd like to chime in also. So it really boils down to the primary care physician to help tailor this type of testing for our patients. So if you will look at the executive checkup packages, and actually they're called executive packages because they were designed for executives in mind. In the beginning, it was just, those are the only people who could afford these things. Now you have HMOs that also cover them, but mostly limited, just to labs. Not everyone gets the colonoscopy or has the stress test. They really just get the basic labs, maybe an ECG, although as you've heard, it's actually not really something that we need to routinely get. So maybe that's something we need to cross out, especially if the patients are asymptomatic or at very low risk for developing cardiovascular disease. But it really is, depende yan sa doktor na magdedesisyon, ano bang kailangan ng pasyente ko. So you have to look at the patient's risk factors. You have to look at the patient's age. As Dr. Dang mentioned, you have to look at the age of the patients in terms of screening. But A lot of our Filipinos now are becoming more overweight and obese. We have a lot of family history of diabetes. So these are really things that you need to ask about when the patients come to the clinic. And it's part of your basic history and physical. What's your family medical history? And this will also lead you down the path. What are the right tests to check for the patient? Now, in terms of maybe formulating public health package, in terms of, again, in a way, we can design it really for them. Maybe one thing we could bundle together is, certain labs to make it cheaper for the patients, things like that. And of course, eliminate the things that are unnecessary depending on their risk factors. Thank you.
Ayan. Salamat, Doktora Mitos. Ako sasagot sa iyo, Doktora Nisa, since I live and work in the province. So, nandun ako 3 weeks ago kasi pinapabakunahan ko po yung kasambahay namin at saka yung staff namin na kinagat ng mga aspin dito ng rabies. So, nandun ako sa Jose B. Lingad Memorial Medical Center, which is the largest hospital. It's a regional hospital po in Pampanga. It's a 1,000-bed hospital. So, I was standing there in front kasi nakikipagchikahan po ako doon sa director. And the director said, Doktora, if makasakali na lang ang mga bulong nyo, we are looking for a mammography machine kasi wala kaming mammogram. Kasi bibigyan sana kami ng mammogram ng DOH, kaso pinili ko yung 2 CT scan. So I was like, hindi ko na inimbestiga what happened to the old mammogram. Baka naman meron, But definitely, yung naghahanap na lang ng mammogram yung 1,000-bed hospital, malaking bagay na po yun. And how could you fault her naman? Because she exchanged it for a CT scan, which is also such a vital, kailangan yun. Kasi if you do have cancer, you will need to find out kung anong nangyari and how can you operate it out of CT. So basically, ito po yung mga problema natin. Equipments pa lang, malaking problema na. And I'm hoping that the DOH could level up po. And definitely, and then the other thing is she said, how could we even screen? Puno kami ng COVID patients ngayon because nobody wants to go to the hospital. So marami ho talaga, But hoping that we move forward from this pandemic and realize that once we screen, it's better for persons kasi nakukuha natin ng maaga imbis na napaka-late. Though, as Dr. Ramito said, talagang isa pa laganap na talaga, epidemic talaga si high blood at saka si diabetes. So yun na lang kung gagawin natin, yun napakalaking bagay na rin. And then let's work on the more difficult or the more procedure-oriented screenings na nangyayari. So yun po yun. That's the way it is. And hopefully, wag tayong tumanggap na yun. Mag-move forward tayo. So I hope that answered your question, Dr. Nisa.
Yes po, Doctor. Thank you, doctors.
Ito, maganda to. Since walang mammogram. To Dr. Elaya, is there a way to screen breast cancer in the comfort of our home? So siguro ang tinatanong niya po is the manual breast exam. Na lang, Dr. Dang.
So yung mga regular physical breast exam, whether it is performed by the individual or the clinician in the clinic. Actually, research hasn't shown that it does much benefit. The clinical breast examinations. It really is still geared towards more some imaging, and in fact, it's mammography. But it doesn't mean that you shouldn't examine your breasts. I guess the take-home message on that part is you need to know what your breasts are like. You need to know what they look like, how they feel like, if there's anything unusual or different with your breasts. That should trigger a conversation with your provider. So although the studies show that the clinical self-breast or clinical breast exam isn't part of the screening programs, it should be a very important in maintaining your own health. You need to just know who your breasts are. Thank you.
So yan, alamin niyo po. To Dr. Mitos naman, why is it necessary to screen for the presence of osteoporosis among women of postmenopausal age? Magandang tanong yan.
Well, osteoporosis, like I said, it's a silent disease. Wala kang mararamdaman habang humihina yung buto mo. And the burden really of the disease is if you fracture, kung nabalian ka ng buto. So even if you had osteoporosis but you never broke a bone, then you're fine. It's just that when your bones get weaker, konting tapilok lang, mapaupo ka lang, even, very forceful coughing, or even just bending down to pick something from the ground, no, you can already fracture. And would you believe that if you do fracture, about 20% of those who fracture will die within that same year because of complications from a fracture. About 80% won't be able to do an independent activity of daily living. They may not be able to walk properly or do other physical activities unassisted. 30% will have permanent disability. And if you fracture once, your risk of fracturing again is 50%. So when we screen patients for osteoporosis, it's a very simple test. No, it's called the bone mineral density. So hindi po siya yung ultrasound ng wrist, hindi siya yung ultrasound ng heel. Those are peripheral density tests. These are central bone density tests that are done in a hospital. Okay, hihiga ka lang, the machine will pass over you, and then you will turn from side to side, and that's it. Low radiation, much less radiation than a regular X-ray, and you have to do it at least once a year, and in the same hospital or the same place where it was done before. So we can compare it from year to year. And then the good thing about it is, if we already see that you're at high risk for fracturing, we can already put you on medication. Kasi yung buto po natin, manghihina pa yan tuloy-tuloy. Once you hit menopause, you lose the estrogen, which is protective for your bones and keeps them strong. The reason why for men it's older, it's because they usually lose testosterone at an older age, and there's no set time when you can tell if they've gone through andropause. Kasi for women, if you don't have your regular menstrual periods anymore, that's menopause na. So if you lose your periods for a year, then you're definitely menopausal already. So that's why we need to screen for this. And would you believe also that there are actually even about 1 in 3 women and 1 in 5 men at the age of 50 will suffer a fracture in their remaining lifetime if they have osteoporosis. And for women, the risk of a hip fracture is even higher than the risk of breast, ovarian, and uterine cancer combined. For men, the risk also is higher than prostate cancer. So it's a very easy screening test. And baka may magtatanong, paano po yan po? Wala kaming bone density. So there's actually a way of looking at a patient's weight and the patient's age. So if you're very, very thin, underweight, and you're much older, there's a tendency for your bones to really be weaker. And the screening tool we have is called the Osteoporosis Screening Tool for Asians. It's the OSTA. So it's very easy to use in the clinic. You just really look at the patient's weight and age. It doesn't completely replace the bone density test, but at least you can tell your patients, hey, you're at risk for developing osteoporosis. Maybe we should already intervene, and you already tell them to avoid falls, to have enough calcium and vitamin D in their diet. And that's how we can at least help the patients avoid that first fracture. Thank you.
Ang ganda naman ng message ni Doktora Mitos. Ako tinamaan nung all the cancers combined, pwede ka pang mabalian. So the simple answer is, why is it necessary to screen for presence of osteoporosis? Kasi baka mabalian ka. And kung mabalian ka, baka ka mamatay. So yun lang yun. So it's quite simple and very urgent. So siguro after we buy the mammogram, bibili na rin kami ng bone densitometry. So talagang kailangan. Okay, to Doktora Cabral, maganda to. Among all the vaccines that you mentioned, Doktora Mitos, what is the most important?
Naku, mahirap yan.
Well, sa akin yung COVID, kasi may pandemic.
I encourage everybody.
Kaya pumili ka, Doktora Mitos.
The only way we're gonna get out of this pandemic po, kung hindi pa kayo nagpapabakuna, please get the COVID-19 vaccine. Very rarely is there any contraindication to it unless you have a severe allergic reaction. So kahit may diabetes po kayo, high blood, osteoporosis, kahit nga cancer. Kung hindi active po yung chemotherapy po ninyo at very immunocompromised po, pwede pa magpabakuna. Other than that, well, for the general adult population, you really should get an annual flu vaccine. Kasi madami rin namamatay sa flu, just the regular flu, not even just COVID-19. As for pneumonia, it really depends also on what age you get it. So either before or after 65, you can get 1 or 2 doses. But, there's a whole list really of the other vaccines that are available to adults. If you're unsure of what you got when you were younger, you may need a booster also. So talk to your doctor about it. But again, tama si Dr. Ana, if there's any one vaccine that you should get right now, please get the COVID-19 vaccine.
Tama yan, Doktora Mitos. Thank you. To our lady doctors, inuulan po tayo ng tanong, so short lang. Okay? Hindi. To Doktora Dang, please tell us more about colon cancer and the need for screening. Kasi we are very well aware of breast. And then of course, lung cancer sa smokers. But colon cancer, I hear, is really going up sa listing ng mga Pilipino. Lalo na going up in terms of frequency and going down in terms of age. So please, Doktora Dang, enlighten us further on this need. Sa tingin ko talagang need ito.
Yeah. In the past, we would always peg colon cancer as number 4, number 5, on the list of malignancies in our country. And just recently, there was an update already that colon is now number 3. And not only are we number 3, so the number has, practically doubled between year 2010 to 2015. So nearly nag-double yung number of colon cancer. And we're also finding it among younger individuals. And so we are realizing, the numbers that we've been basing things from years past are different because, we assume it's because our lifestyle, it's different. Our exposures to carcinogens are different. We eat more junk food. So all of these things, we are more overweight. And so all of these things increase the risk of developing polyps, which eventually deteriorate into cancer. Now, in terms of being younger, we also don't know, is it because we are screening more aggressively now? Has it always been there? Hindi lang natin napipick up before because we never really encouraged doing colonoscopies or alternative colon cancer screening programs. So it must be a combination of all of the above. It might be we are screening more, people are getting younger, but the bottom line is, when it comes to colon cancer, really there is a possibility of cure. If we find the problem early enough, we have a good fighting chance of achieving cure. And so if we do get their screening programs in, may benefit. Now, many people are intimidated by a colonoscopy because it is a procedure. It involves anesthesia. You come to the hospital. You don't know what's going on. And a camera is inserted in your backside. Okay. So many are very intimidated by this procedure. But, I talk to patients about it, and most actually realize that it's the best way to go. Now, definitely, there are alternatives to a colonoscopy. That's not the only test that we have. And so I always explain that we have the option of doing a scan, an option of doing stool test. Definitely, there are options. Now, although I am partial to encouraging a colonoscopy because, right there and then you can take care of the polyp and prevent cancer. But I don't want to necessarily sway people that way because it has to be an individualized choice. So we always give alternatives, and the important thing is they get to pick something. Because if you don't pick, that's going to be where our problems start. So we just need to encourage someone to choose. Maybe I'll end with that one muna there.
Ayan. Ang na-pick up ko sa sagot ni Doktora Dang talaga, yung number 3 na. Number 3. Colon is already number 3. Hindi na siya number 4 or number 5. Number 3 na. And I personally have seen 20s pa lang. So, nakakatakot na talaga. So, Doktora, please mention hemorrhoids lang. Parang, kasi ang dami nagsasabi, hemorrhoids. Ano ba yan? And how can we move forward from that issue na puro hemorrhoids na lang? Next thing we know, ang laki na pala.
Yes, I have picked up many cancers with the starting premise that they have hemorrhoids only. And in fairness, it could be hemorrhoids, it could be both hemorrhoids and cancer. And so we just need to still remember and go back. Remember yung pinicture ko na parang lotto numbers, you just still remember those cut-off ages. So hemorrhoid kung sa hemorrhoid, but if you're already 45 years old, we still need to talk about doing cancer screening. So it always goes there. Now, if patients are having symptoms, this already falls beyond the screening, quote unquote, executive checkup panel. So if patients are having symptoms, masakit ang puwet, meron akong dugo kapag nagpapahid ng tissue paper, that falls beyond the executive checkup. That becomes a symptom-based case finding, diagnosis, investigation. So medyo iba yon. But minsan, so many times na nagpapasalamat din ako sa hemorrhoids because, I have 30-year-olds coming to me, Doc, may hemorrhoids ako, silipin natin yan. Only to find large polyps, cancer. So lahat kami nagsasabi, buti na lang nagka-hemorrhoids ka. Because it also leads you to get to do the appropriate test. But just don't fall into the hemorrhoids lang yan kasi hindi ka pa 45. So always remember, symptom is different from age screening cutoff.
Ayan. Very good. So huwag niyong upuan yung hemorrhoids niyo. Patingin niyo kay Doktora Dang. Okay. So, Doktora Nisa has a question. Ayan. Okay ka na, Doktora Dang?
You were mentioning something that resonated with me kasi nga everybody's so scared about the COVID pandemic that the issue of screening has kind of fallen into the back burner. But we always just need to think and remember that we shouldn't forget about it kahit na nagpa-pandemya. Many institutions are able to institute healthcare protocols so that we can still continue with our checkups and screening, and because we don't want to, ang worry ko is 5-10 years from now, we will suddenly see a shoot up of cancers because everything was shut down in the time of pandemic.
Ayan. So, thank you, Doktora Dang. So, if we put together the answer of Doktora Mitos and Doktora Dang, ang dapat gawin ng mga tao ay magpabakuna po ng COVID and then magpa-screening ng cancer. Okay.
Correct.
So, may request po dito si Doktora Nisa to ask a very, ito po, questions din po from Doktora Nisa. Doktora?
Thank you for doctors. You mentioned COVID has really how we approach health, how the healthcare system works in this country. And I remember especially in the provinces and here in Western Visayas specifically, hindi pa ganun kataas yung cases ng COVID. But there was a time that there were more mortalities due to mental health related problems in the Western Visayas region compared actually to COVID-19. And if we go back and we trace it back, we know that these people have these problems. These didn't just start during COVID. They could have been triggered during this time, but these problems started much earlier. And as Doc mentioned, if we screened this or if we caught this earlier, then maybe this patient could have gone into therapy or some sort of treatment. So my question is, we've been talking a lot about the medical aspect of prevention and screening, but from a psychiatric's perspective, do we have programs or do we have programs in place for psychiatric or mental health screening?
Thanks so much, Doktora Niza. I think Doktora Dang and Doktora Mitos, ang tanong is, parang nauuso na talaga yung mental health. Hindi naman nauuso, but I think they're becoming more aware. So parang, I think our executive checkup should also look into this. Right now, tayo tatlo, we are all specialists. We are not psychiatrists. Pero I think, since tayo ang unang puntahan ng mga pasyente, then we should also be aware kung may problema sila na o may pinagdadaanan. Dr. Mitos or Dr. Dang, does anyone want to pick up Dr. Anisa's question?
Well, mental health checks aren't really part of the executive checkups, no? And you're right, it really should be something that we should add, or maybe we should already start looking at. The advantage of having, patients who come back to you on a regular basis, you can sort of tell, something's not right if they're not the same the next time you see them. But in general, with any patient, no, as part of your bedside manner, you just ask them, how are you doing? How are things at home? While you're typing out or writing out your prescription or your lab request, ask them how they're feeling. And, patients really tend to trust their doctors, and they open up to their doctors when they don't open up to other people, for example, or even their family members. We don't have a lot of mental health programs out there, but they do exist. Okay, there are several nonprofit organizations, schools also that provide mental health assistance. Okay, and of course, I personally have some numbers already for certain psychiatrists who are open to taking teleconsults, because that's really how it's also happening right now. Takot pumunta sa ospital, diba? But again, if you have to go to the hospital, please go to the hospital kung kailangan. And like Doktora Dang said, if you need to be screened, don't wait 2 years later after you have that bleeding in your stool to just get checked, because by then it might be too late. But yung sa mental health, wala pa talagang very robust program, but it's a good thing we're starting to recognize these things. And maybe all of us should really be more cognizant of where we can refer these patients. Kasi kung hindi ka naman psychiatrist or psychologist, mahirapan po talaga tayo. And it's a big burden also on the physician if you aren't able to handle it well. But know that there are public and free programs out there also for these patients. Thank you.
Ayan.
Thank you for that.
Maganda yung sinabi ni Dr. Amitos, because as an internist, we tend to follow people through the years. So nakikilala na talaga natin. And napapansin din natin na may iba sa pasyente natin. That's what makes us good doctors. Dr. Dang, gusto niyong mag-comment ng konti about mental health in your practice?
Yes, tayo kasi, we have to be, you look at the patient as a person, holistic. I know I'm a specialist in gastroenterology, pero I just don't focus on binundugo ba yung pupo mo, or I just don't focus on that. I look at the whole patient and kind of build a relationship. As we've been trying to underline, this is a partnership. You have to work in partnership with your patient so that you can improve their health. Now, isang tao lang tayo eh. So, kunyari ako, I can only see 10 patients on a day. I can't see a whole bunch of people. And I guess this is where healthcare institutions come in, because although the executive checkup becomes almost like a decahon package, this is checklist 1, 2, 3, 4, 5, it instills in people that, maybe I need an executive checkup. Do I need one? And then they call their doctor, Dr. Laya, anong gagawin ko? And then ako naman, I try to see which one we can do for patients, try to add on or maybe cross out on what we don't need. Now, in terms of yung mental health questions, sometimes actually, sometimes it's just a one-liner. Are you doing okay? How has this pandemic treated you? Did you lose anyone during COVID? Sometimes just opening up a question like that already gives you an insight on an individual's emotional, mental health. And then exactly what Dr. Cabral said, if you pick up a problem, then you can turf to your colleague psychiatrist. Because syempre, ano naman ang gagawin ng GI dyan? But sometimes really just asking that question and telling your patient that they matter has already given them a big impact. Now, we can go even beyond the mental health aspect, because minsan nga rin, mga one-liners na nga kailangan natin eh. Sasabihan ko yung mga young girls and boys that come into my, not teenagers, but the younger professionals. Don't drink, don't drive, don't do drugs. And it sticks with them. They remember it. Years ago, naalala ko sinabi mo sa akin, wag akong iinom. So, nag-guilty ako, so hindi na ako umiinom. So, again, those are the little things that we can incorporate in our own practice to be able to help people. So, I think that's it.
Ay, thanks, Dr. Dang. Ang ganda. I think it's very appropriate ngayon talaga na buksan natin yung door towards mental health. And tayo as internists, tayo ang sigurong unang kakutukan eh. Kasi it's very rare talaga that people will go straight to the psychiatrist. Unless, of course, alam na nila, no? So, thank you, Dr. Anisa, for this very valuable question. Kasi sometimes we focus a lot on physical health, and it's time for us to realize na kaakibat din ang mental health sa executive checkup. And tama po si Dr. Laya, it's being sensitive to your patients and just asking kumusta na kayo. That alone can open a whole lot of things to talk about. So, andyan na po tayo. It's been more than 1 hour. Ang bilis ng panahon, ano? So, let's ask our speakers to be ready po for their last words of encouragement. Ayan, Dr. Dang, What is your words of encouragement po sa mga nakikinig ngayon at mga natatakot mag-executive check-up dahil sa pandemic?
Really, it is just taking that first step to sit down and have a chat with your doctor. Because patients learn a lot with a conversation with a physician, and physicians learn a lot from their patients also. And again, I can't underline how important it is to be a partner in promoting good health. So just open the door and get the conversations going, and it will encourage people to become more proactive about their health.
Ayan. Thanks, Doktora Dang. Doktora Mitos, words of hope and encouragement. Andito pa ba ho si Doktora Mitos?
I'm
Or
sorry.
nakat off po? Ayan.
I'm here. Sorry about
Hindi,
that.
mahina talaga internet na nasa
Okay.
Pilipinas tayo. That is the way it is. So
Anyway,
please, words of encouragement, lalo na sa mga diabetics out there, please underline yung need nila.
Yes. So, marami po tayo talagang at risk, sa totoo lang. No? If you're overweight, obese, if you have family history of any of these illnesses, if you've ever had a borderline blood sugar or a slightly elevated blood pressure, just go see your doctor. You know, your doctor will tell you, sige, come back 3 months, 6 months, I'll see you in a year. If you're scared, just see your doctor kahit once a year man lang. And you can start from there. No? Like Doktora Dang said, just open the door, take the first step. If you can't remember the last time you did anything, any test that you have to do once a year, just do it on the month of your birthday. Okay, so at least next year, oh, that's the last time I did my tests. That's what I tell all my patients when they have to do, their mammogram, they have to do their bone density screening. If they're already patients who are at risk for osteoporosis, colonoscopy is not every year. Okay, those are one of the things also that you should remember. But at the very least, if it's your birth month, as a gift to yourself, remember to get yourself checked and then go from there. If you need to be seen more frequently, then your doctor will tell you. But please do not be afraid of your doctor. Do not be afraid also of going to the hospital, because we all take precautions, and COVID is here, but we also need to learn how to live our lives, and just also be assured that COVID will also go away at some point. Okay, so take care of your health now and don't wait until it's too late. Thank you.
Ayan. Thank you so much, Doktora Mitos. Yes, COVID is here. But nandito rin po si cancer, si diabetes, at napakarami po. Hindi sila umalis. So dapat malaman natin and to do something about it and to have a conversation with your doctor and change your lifestyle to be one focused on your health and well-being. So again, salamat Doktora Mitos, salamat Doktora Dang, and thank you for your insights, Doktora Niza. And sana po may nalaman kayo, and thank you everyone for the insights on the importance of the executive checkup. Ito po ang ating first edition at babalik pa po tayo for more health insights. So I'd like to thank the Mu Sigma Phi Sorority, would like to thank and express our gratitude to our partners, the UP College of Medicine, the Philippine General Hospital, and the City of Manila. We are also thankful for our sponsorship by the Insular Life Assurance Company Limited and our official media partner, our Awesome Planet. Thank you so much also for the unending support of the UP Manila Information Management Systems and the UP Manila Postgraduate Institute of Medicine, as well as Councilor Leila Cuna and Councilor Crystal Bacani. And most of all, thank you everyone for spending your lunch hour with us. Again, paulit lang po, for those who are healthcare professionals who are interested to obtain CPD units, please fill out the evaluation form. Nandyan po, naka-flash sa screen. tinyurl.com, New Webinars 2021. Kailangan po within 3 days after this forum. We'd like to also invite you for the next leg naman po of the Mula kay Doktora, Doktora Julita Ramoso-Jalbuena Women's Health Forum. This is on August 10, Tuesday, 12 to 1. Title po is Ready, Get, Set, Go Surgery. Or tara na, maghanda po tayo para sa ating operasyon. Ito naman po ang concerns regarding preparation and prevention of complications during surgery. So our speakers will be anesthesiologist Dr. Grace Herbosa and OB-GYN Dr. Lilibet Siasu, and will be moderated again by yours truly. So maraming salamat po everyone for your support and participation for the Women's Health Forum services. Salamat po and good afternoon. Thank you.
Thank you for attending the first event under the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. The MU webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the InLife Sheroes. And this event is covered by our official media partner, Our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine, as well as to Councilor Lay Lacuna and Councilor Cristel Bacani for their unwavering support to this forum. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/MUwebinars2021eval. Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/MUwebinars and our Twitter timeline at twitter.com/MUwebinars. You may also email us at muwebinars2122@gmail.com. Before we end, we would like to invite you to the next leg of the MUla kay Doktora, Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on August 10, 2021, Tuesday, from 12 to 1 p.m., entitled Ready, Get Set, Go Surgery. Tara na, maghanda para sa operasyon, which will tackle concerns regarding preparation and prevention of complications during surgery. The speakers will be Dr. Grace Herbosa and Dr. Lilibet Siasu, and to be moderated again by Dr. Anna Bondok. And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for attending this webinar. Have a good day.